Hello viewers, welcome to my channel Pharmacypedia. In this video, we are going to learn a very interesting topic that is about the package inserts or patient information leaflets. Package inserts are basically the folded papers which you find enclosed inside the boxes of your medicaments. For example, in various syrups or like various ophthalmic solutions, you find a piece of paper which is folded and contains a lot of information. So the first takeaway from this is that being a pharmacist, it is our moral responsibility to guide the patients, to guide the consumers, to always go through the leaflet. This leaflet contains a lot of information. All the risks are being communicated clearly to the patients. Since all the information given by the doctors to the patients are not sufficient enough, they cannot memorize and remember all the information which is being provided during the time of the prescription writing to the patient. So some of the informations are sometimes missed off. They can be taken care of by reading the patient information leaflets. Now the package inserts are the folded printed documents which are along with the medicaments and contains how to take the medications. It contains a lot of information that we are going to discuss in detail. Moreover, it can help safe medication use. How you have to take, suppose you are taking some aerosols inhalers, how you need to take that, or like how you should go ahead for a successful treatment and at the same time protection from the side effects. So it contains various information in the form of the doses, in the form of the strength, which will guide you in case something happens or like you have some confusion in your mind, you can refer back to the patient information leaflet. So being a pharmacist, we should always guide the consumers to go through the leaflet very carefully. Now patient information leaflets, the very first important thing to know about that is it is intended for the consumers. It contains the focused, safe and appropriate informations. It contains the warnings. It also at the same time nowadays provide encouragement for reporting any sort of the issues. Due to the widespread use of the pharmacovigilance these days, the number of issues, the number of side effects reported can be reported now, and various other ways of information are provided in the leaflet whereby you can communicate the any sort of the side effects or contraindications, and they can be reported out. So broadly, they contain all the information which identifies the medicament and what is the purpose of using that medicament in the form of the indications. Then how to use that. If suppose you are using some medical device, using some sort of uh, any other medicament, aerosols, inhalers, then how you have to use it, the procedure, detailed procedure is given in that leaflet. Now apart from that, other information about the device, about the manufacturer details are also provided in the package inserts. So the inserts are being designed in such a way by the experts, by the medical people, that they need to contain the concise information, accurate information, and each product, as per the regulation, should have a patient information leaflet. Now they basically starts with the proprietary name and the pharmaceutical form, whether it is injection or it is syrup suspensions, and it should correspond to the package inserts. Now it contains details about the strength of the active ingredients and quantities, and rest of the excipients, their list is mentioned over that. Then apart from that, it also gives you details about the pharmacotherapeutic group of the active ingredient along with the indication. Indications means for what purpose it is being generally used. Then at the same time, it contains information about various other things, like in the case of pregnancy and breastfeeding, how safe is the medicament in case of the pregnancy and breastfeeding, or like you are using any alcoholic syrup, then driving, and you can use machinery or not. That sort of the details are also being covered up in the patient information leaflet. And apart from that, other important information about some of the ingredients, for example preservatives or like some controversial ingredient, is also being provided over in the leaflet. Apart from that, it also talks about the interactions causing agents. For example, whether the medicament can be taken with any sort of the food or drinks, like it is being found that they have various food interactions, like you cannot take some sort of the syrups along with the grape juices or like that. Apart from that, it also provides you detailed information about the warnings, about, about the special precautions that need to be followed, whether you can take that medicament with another medicament or not, any sort of interactions if it exists, or like contraindications are there, any side effects, all the detail in a logical manner are being placed in the patient information leaflet. It also gives you insight about what is the general dose depending on the strength of the medicament, and if you sometimes miss out the dose, then what you should do, or like if you forgot to take the medicament, or like you in how much extent that medicament is found to be safe, or what is the general prescribed dose. There is a fixed format for the designing of the patient information leaflet. It starts with the presentation. Presentation means the outer look of your medicament. It starts with that photo, and along with that, it gives you whereabouts of the name and address of the holder, along with the registration number, and also the details of the organization who prepared the leaflet, along with the contact number and address. Sometimes these leaflets are being provided in the local regional languages so that it can be easily read by the consumers, easily read by the patient. So it has to be designed in multiple way, or it should be provided you must have seen that patient information leaflet are also printed in both the language, like for example on one side they are printed in the English language, on the other side they are being prepared in the regional language. The reason being that since they are directed towards the patient, so the patient should be comfortable to go through the patient information leaflet. Then apart from that, there are certain things that needs to be taken care while preparing the patient information leaflets. For example, the use of complex language and medical terms should be avoided. It is being indicated in the guidelines that while preparing the PIS, it should be carrying the simple layman language. Use of colloquial complex words should be avoided. Short sentences with simple meaning should be interpreted by the patient so that the patient don't feel uncomfortable while going through. If the information is placed in a simple manner, it can be of great help to the consumer. We need to understand the patient compliance at the same time. Also, all the details about the side effects, contraindications, if any research studies that needs to be placed in the PIL so that the consumer is aware what medicament he is taking and what sort of the side effects can be expected, or like contraindications if it exists, how it needs to be communicated back. It contains all the information in a proper logical manner. So, as I've discussed, it contains about the identification of the medicament, proprietary name, strength, dosage forms, indications for what purpose it is being used, any information necessary if you need to understand before the taking the medicaments. For example, the medicament needs to be an empty stomach or like that. All the situation where this sort of the medication should not be used, along with the warnings, side effects, facial precautions, interactions, or it is if it is directed for special group of patients like pregnant or nursing mothers, can they take the medicament or not, is it safe to take during those conditions or not, or any effects of the medication that may have on the patient ability to drive the machinery. Yes, it is very important. When we talk about the layout, format and the design, one must understand that since patient information leaflets are directed towards the patients, it has to be in a very simple manner, simple font, Times New Roman 12 point or maximum 14 point. It should be easy to read. It should be having a light background so that the consumer don't find it difficult to read out. It should carry the simple language, short paragraphs, bullet points, point wise, or very short sentences. Everyday plain language should be used, and complex terms should be avoided. Now, once the patient information leaflet is being prepared, it needs to be get approval by the various other experts. It needs to be approved and finally approved by the head of the department before being released. So that if any sort of the complex language has been used, it can be rectified. It should be as per the guidelines. The guidelines simple says that since it is directed towards the consumer patient, it should be kept simple. Complex words should not be used. Simple language in simple font, it should be the information whatever is cited over there should carry the reference. It should be accurate information, and it should be regularly reviewed to ensure that they are in compliance with the current best practices, guidelines and standards. The reason being that the research findings do change over a period of time. So in case, it should not be freezed, एक बार बन गई तो बन गई, ऐसा नहीं होना चाहिए. It should be actually being revised after periodic interval of the time, so that the any sort of updates can be there. So the guidelines on the writing PILs clearly states that the identification and the structure of the information and the list should be as per the guideline. The content of leaflet should be able to identify and answer all the queries of the patient. So when you go to the doctor, you have the prescription with you, you have a number of questions in your mind. So is the PIL able to solve those questions? If yes, then it is the correct document. And also at the same time, it should ensure that the information cited should be accurate. The patient can also have other sources, or he can consider, so it should be accurate information. And moreover, the emphasis should be given that it to cite the accurate references, so that they can be being referred if required. So the patient information leaflet designing should be simple. It should carry all the information relevant, and it should be able to answer the queries of the consumer, and at the same time provide how the detailed procedure of how to use the medicament. So it can be simply be remembered by remembering these two terms. KISS, it actually refers to that patient information leaflet should be kept short and simple. So it should be keep it short and simple. And by remembering the term cares, it clearly indicates clear, accurate, readable, and empathetic. We have to be empathetic with the consumer. So by remembering these two words, care, clear, accurate, readable, and empathy, and KISS, keep it short and simple, you can understand the details about the patient information leaflet. Thank you for watching my video. Please do like, share, and subscribe Pharmacypedia. Also, please provide your comment in the comment box. Thank you so much.